Hello, this is Dr. Yates and this is Tara, and we're just going to go through 6 things that I think is essential before you make a decision for a hair transplant. We see so many patients during a given week and they ask us so many questions. All of them are good, but it's really hard to find out what are the real answers because everyone gets their information from the internet. And the internet, as we know, can have some facts on there that really are not true. So let's start at the easy stuff. Number 1. I think any doctor that you're going to see for a procedure, we say what? Experience matters, okay? So that's number 1. Now, how would you ask a doctor that? You would say, well, Dr. So-and-so, how many of these procedures have you done? Now, most doctors who've done a wealth of these procedures, they'll say in the thousands, in the hundreds, but you have to make sure when you ask them this question, you say, Doctor, what procedure are you talking about? Because sometimes doctors will have an emphasis to just kind of throw that procedure in with other procedures. Say, how many FUEs have you done? How many strips have you done? Because I'm a believer, the more you do, of course, if you're getting better and better as you go, the better you're going to get. So experience matters. So if somebody that you know just has done 30 and someone has done 300, I would take that into consideration. Number 2. This is very important. I think as the world progresses, there's never going to be a way of doing something that was done in 1979. The way we build cars is not the way we built cars in 1980. The way that we in the hospital do operations is not the same that we do in 1980. And this should hold true for hair transplantation. You must move with the times. There are a lot of new technology available. What new technology? Okay, 1, there's what's called follicular unit extraction, where you punch the grafts out one by one. You can either do that yourself, or there's actually a robot that does that, the ARTIST robot. There are other new technologies like laser light, which is available. There's PRP available. There's stem cell that's also available. Now, I'm not saying some doctors don't believe in this, but I think that somewhere along the line you have to move the needle and move toward progress, okay? So I think some of these things should be available. I'm not saying if the doctor doesn't do it, that's bad, but I'm just saying that conversation needs to be had. Let's go to number 3. Very important to me. There's a lot of fighting and debating in doctors' offices who do FUE surgery. Who should do the FUE? Now, when I was a cancer surgeon and a trauma surgeon, I can tell you one fact. There was never a nurse in the operating room who was taking out somebody's gallbladder, taking out the pancreas, or repairing the bullet wounds. The doctor was trained specifically to do that through the residency program. So, I'm a firm believer, you must, as a doctor, it's a learned skill, you punch out the grafts yourself. And I've had a lot of patients say, well, the tech did it for me. The tech, and to me, I don't see how that's a good idea. If the tech did it for you, then I think you should write the check to the tech and not the doctor, because this is what you're paying the doctor's expertise for. 1 is to actually do the FUE, remove the hair, actually do the site making, and sometimes even insert the sites, because there's 3 steps to a successful hair transplant. 1, retrieving the hair. How do you do it? The old way, you take the strip, that's called FUT. The new way we call FUE. So take the hair, then make the sites. Those are recipient sites. The way those sites are made determines the way your hair grows. Does it grow up like this? Does it grow like this? Does it grow like this? Does it grow backwards? Somebody has to make those decisions. I think the doctor should make that decision. And then the hair has to be put in. And a lot of people will say, well, does the doctor put the hair in? I personally know how to, but I don't, because it must be done fastly, and expertise must be involved as well, because if you're doing a 1,000 graft, 2,000 graft case, you need more than one hand inserting the grafts, because what matters is every time you punch a graft out of the back of the head, that graft does not have any blood supply. The out-of-body time increases. It only makes sense the shorter time the graft is out and the faster it gets back in, better chance to live. Common sense. Let's go to number 4. This is a big one. Every doctor I know has a website, including myself, which proclaims that doctor as the greatest doctor in the history of the universe for hair transplantation. Now, how would you know that? And this is how you have to really get smart. One, you need to see a live patient, because as we know from Facebook, Instagram, Slapchat or Snapchat, whatever it is, that you can make a picture look any way you want to, okay? And also you have to look at the views. You'll see one picture with a guy with his hair like this, and then the next one he's looking like this, and it looks like he has more hair, you know? So you can't do that. So this is what I recommend to all the people that see me. You want to see a live patient, meaning you want to see a patient who's had a hair transplant. You want to comb it yourself and see what the back looks like. If you can't do that, I'd recommend you get on the phone with the patient and do a FaceTime with that patient, because photographs you will make a mistake just comparing photographs, because the angles are different, the hair lengths are different. If you're going to compare a photo, the hair lengths need to be the same, because the donor that you're taking the hair from still needs to be the same as it is when the hair is grown out up top. Okay, so you have to get really proficient at looking at pictures, or you will get fooled. Number 5, doctor's credentials. This is a big one. Who gets to do the surgery? I mean, how does anyone even get to be a hair transplant surgeon? I told everyone that I was a trauma surgeon and a cancer surgeon. How on earth did I get credentials to be a hair transplant surgeon? Okay, the real answer is, I said I'm a hair transplant surgeon. That's all it takes. You have to be a doctor, and you can say you're a hair transplant surgeon, and hopefully somebody will show you how to do it. But there is no board certification process or residency specifically for hair transplant doctors. Like, say if you want to be a cardiologist, you go to medical school, you could do an internal medicine residency, and you do more training in cardiology. It does not exist for hair transplantation. So a lot of people will come in and say, somebody said they were double boarded in hair transplantation. You know, I gotta tell you, that doesn't exist, because to be boarded in the United States, it has to be recognized by the American Board of Medical Specialties, which is here in Chicago, which I think began in the early 30s. And there are only 20 to 30 boards that is recognized by the American Board of Medical Specialties. Now, there are a million other boards out here. Does that mean that those boards don't mean anything? No. But if somebody's going to say they're board certified, that certification has to be recognized by the American Board of Medical Specialties, or otherwise it doesn't mean what the doctor's trying to say that it means, that they're board certified. And I just want to say one thing, because I used to be a board examiner for the American Board of Surgery. People who are board certified take it so seriously. When they hear about some doctor saying they're triple board certified and quadruple board certified in things that exist, it's not fighting words, but it's just not taken well. And to be a part of the American Board of Medical Specialties, this is how rigorous it must be. You must be an MD or DO at an approved school. You must go through a residency program that has been approved by the American Board of Medical Specialties, like a surgery residency, a dermatology residency, so forth and so on. Then you must have demonstrated proficiency in your field by the residency program. Then you take exams and you must pass them. Now, I can guarantee there is no program in hair transplantation that fits what I just said. So you have to look at your doctor's credentials. Actually, how did he or she get to where they are now? Okay, and be very careful of that word, board certified, because you have to know what that means. Let's go to the last one. What does your doctor's hair look like? Now, I'm not going to profess that my hair is the greatest in the world, but it's just like when I go to the gym and I get a trainer. I don't get a trainer whose stomach is bigger than mine. You know, I don't get a trainer who's wider than me, you know, because you're shooting, if that person is a student of their craft and believes in what they're doing, they should actually show it, you know, and if they don't show it, there should be a reason for it. Or when you get your hair cut, you don't go to the barber with the slided hair and wearing the comb over or whatever. You go to the stylist person you can. So this just makes sense. this to me tells a lot. When I go to different conferences and I hear people talk about hair and I look at their hair and so forth, they're probably looking at my hair too, but I think these are common sense things that you should look at. What does your doctor's hair look like? And for some reason, if their hair, say, doesn't look like you think it should look like, well, maybe you should ask, well, how come you haven't had a procedure, doctor, or why this or why that? And most likely they might have good reasons, but I think this says a lot, just how does your doctor's hair look. So these 6 things, I think if you stick to them and really understand them, you'd be able to make a really good decision. I think the most important out of everything I said is you have to talk to a live patient, because photos are notoriously will lead you in the wrong direction. So I hope this helps. You can come see us in Chicago or call me anytime. This is Dr. Yates.